So, good morning, everyone. Again, welcome to the new world, what we're all dealing with, and how we're all getting through it. And we'll get through it working together as one, coming up with problems to the solutions, working together. So, as of today, we have 2,190 positive cases of the coronavirus in Albany County, 844 people under mandatory quarantine. So, we have an increase again of 22 positive cases since yesterday. Which is alarming because we were hoping after this Hudson Park party and everything else going on and people traveling that number would steadily start to go down. So this is not all the numbers of the 22, but it's just a little bit of a synopsis, a little bit of a breakdown of where we're at. Among the new positives, there's 5 cases involving healthcare workers or people in congregate living settings. 1 positive from today's report traveled outside the state. 8 have close contact to positive cases, and 2 they're still working on, some of the infections of where they got it from. So, of these new cases, we now have 4 are linked to the Hudson Avenue party that were there between July 3rd and July 5th. But you have to remember too. Now that brings up that party to 37. Doesn't mean these people were at the party. It means that people that were at the party went and exposed other people, not knowing, unwillingly, hopefully unwillingly. It also shows you the domino effect that I've talked about. And we are outside that 14-day window, so you shouldn't be seeing this. But what has happened is someone who was positive with it obviously was around someone that wasn't, so that window gets extended. But the good job that the Department of Health does with their tracing and their epi team, they basically tie it back into there. So like I said, now it's 37 people that are linked to that party. So it really goes to what the governor's been saying since day one. We're all in this together, and as we continue to go out, and I've identified months ago, if everyone recalls, and I said this yesterday, identified the 20 to 29-year-olds. They're the ones out there with no signs or symptoms, and they're the ones thinking everything's great. It's not affecting me. They continue to say it's not affecting our age group, and they're the ones continuing to spread the virus amongst everyone else. And that's where we have to be careful. So I just want to remind people that, and it's like when we sat here before, Dr. Whalen and I, and talked about different, labor, or we had Memorial Day weekend, different Easter, things we were worried about, when we started to open up, Father's Day, Mother's Day, things we started to worry about when people were going to get together and work and be in close quarters. We always watch that 14-day window to see how effective, especially with the protests going on around this country, but especially here in the Capital District. And I will say this, I have, I get the question all the time, why didn't we see the numbers spike up? Listen, they wore their masks, they weren't at a party, they weren't sharing drinks, they weren't sharing food, and they weren't in each other's sick space for the most part. So it worked, and thank God it didn't spread from that when everyone was getting together. So one of the things I want to say, there's 110 active cases in Albany County now. So just to let people know, and that's the number everyone wants to know out of the total number of exposures that we had. We had 49 back on July 10th. 49 active cases. Now we're back up to 110, so we're going the other way. So these are things that we watch along with the hospitalization rate. So, I just want to point that out. I'm not trying to scare people, but just saying you go from 49 back on the 10th of July to 110 just shows you the direction we're all starting to head. And the last thing I want is to give anyone reason to shut down things again. The shut down restaurants, the shut down stores that are finally opened up, trying to make things work, to pay the bills, to pay the workers, and then they say, oh, what? You know what? Too much exposure. Everyone has to close their doors again. And look, we fight every day. We didn't have a control room meeting yesterday. I'll be bringing it up to General Murphy today. One of the things that we're talking about is, getting gyms back open and movie theaters and things like that. And it makes it hard case when you see the numbers go at it and they start to go in the other direction. 6,725 people have completed quarantine. Of those, 2,080 tested positive for the virus. Increase today of 3, and we still have 6 people hospitalized with a hospitalization rate of 0.27, that tested positive. Yesterday, that rate was the same, so that stays the same. Some good news out of the 6, the one person that was in the ICU is no longer in the ICU, so they at least recovered enough to come out of the ICU, which is always good. Over the last 5 days, there's been an average of 18.6 new positive cases each day. Yesterday, it was 14.4. Everyone, I say this, everyone should get tested. Look at, I'm going to say this, I'm going to keep saying it and sound like a broken record. Please go and get tested. It takes 5 minutes, maybe 5 minutes to sign up online or make that phone call. And, just so you know, especially to these younger kids, especially to the travel teams that have been out there. Look, we're getting a lot of complaints from a lot of people that have been outside the county, outside the state of New York with travel basketball. We had the lacrosse, we had other things going on. You're not supposed to be playing basketball. You're not supposed to be practicing. I know some coaches are being creative, doing 3-and-3, calling it drills. Listen, it's the reason why the NBA shut down. Please, pay attention. I know these kids want some normalcy. I know they want to get together. I get it. I want the kids to get out, but do it in a safe manner. Help us stop this so we can get back to some type of normalcy where everything's back up and running again. And the last thing we want to do is get back running everything and then have a second wave and shut things down again. I'm trying to help these small businesses stay open. Because I can assure you, as I sit here, they can't sustain another shutdown and open up their doors. There's no way they're going to make it. And most of them are going to have a hard time keeping the doors open the next couple of months. And I will say this, I encourage everyone, please, stop going to the big box stores, go to the little stores, shop at the little mom and pops, the corner ones. Give them the business because they need it more than the Fortune 500 companies. Schedule an appointment with the state's testing site at Albany. You can call the number, as always, 1-888-364-3065. And our mobile testing sites, please call there. Great partnership with Whitney Young. Area code 518-465-4771. And Rite Aid, as always, online. You can call Rite Aid, or you can't call them, as I was. You have to go online and register for the Rite Aid to make an appointment online, but it's pretty easy. And like I said, you self-administer it yourself when you pull in. It's a lot easier than the swab going down your nose. So people that don't want that to happen, that's your next best bet. The Priority 1 in Gilliland, as always, does the antibody testing. You can call them 518-867-8040. And again, remember, just 4 simple things. Wear your mask, cough into your arm, clean your hands, and stay 6 feet apart. Not unless it's your family, the same nucleus of people you've been hanging out with and you keep track of that group. But, we get to question all the time, what's it like to be a tracer, to, find out, it's like being a little bit of an investigator. I'll say this to the people, I'll challenge you at home. Think about that person that you talk to, the neighbor or somebody, the kid that comes over your house. Who were they in contact with? And just ask a couple basic questions. Oh, where were you today? Who have you seen the last week? Were you out shopping? Were you out doing this? Were you wearing a mask? It's pretty simple. And again, if you keep that tight group, you're not going to have an issue. So help us do our job. But Dr. Whalen.
Good morning. And as I see the slide is up about how to correctly wear a mask, and I want to reinforce, as I do every time I get the chance, that is an essential strategy for people to protect themselves and to protect the health of others. So please do your part. Wear a mask. It's unfortunate. We are starting to see the numbers climb up, and as the county executive indicated, from a single exposure can stem multiple cases. And what we're seeing from the example of the Hudson Avenue party is how we can get from a small number of cases exponential growth. So we see that people that were initially at the party were affected, but as we start to get more cases, we start to see that some more tie back to people that were at the party. So it doesn't necessarily mean they were in attendance, but they may have been a family member of someone who was in attendance. They may be a business contact of somebody who's in attendance. And we have seen evidence where people that were young and had relatively mild or asymptomatic infections have infected those around them that may have been more vulnerable to the infection, who have needed hospitalization. So this is serious. This is something that is very important for our younger population to realize, that your actions matter. What you're doing on a daily basis can affect the health of your family, your friends, your loved ones. We've seen this across the country. There are numerous cases that are being reported of people that just thought it was okay to do one little thing, and then the sequelae that follows really leads to regret, and we don't want people to have to experience that. So it's very important to follow public health advice. We know things have started to open up a little bit, and this makes our job at the health department very difficult, because when we were getting cases when there was shutdown, people really had a limited amount of contacts. And now we're finding people are really out socializing and doing what they did before COVID. So when we contact people, there are multiple contacts that they have associated with cases. This is how exponential growth occurs. So you can start with 3 cases, which go to 9 cases, which quickly over a short period of time can bring us into hundreds of cases if we're not careful with how we control our behavior. All of us need to know, again, that we all play a part in this, and all of us are charged with really limiting the amount of exposures that we have on a daily basis. Even though we have had openings, it is very important that people remember that COVID is still with us. And in fact, we are now starting to see increased numbers of COVID-19 in the community, and we are seeing some people that are getting quite ill with this. So I don't want to perpetuate the myth that this is just asymptomatic. It's not asymptomatic. There are people that get very sick with this. Unfortunately, we can't always predict who is going to have a serious infection. So why risk it? Why risk it? Wear your mask. Stay home unless you need to go out. If you are going out, utilize the protective strategies that we have been talking about implementing from day one. Use your mask. Wear your mask correctly. Practice frequent hand hygiene. And stay at home and social distance over 6 feet when you're around other people. If you limit your contacts, it limits the spread. If you limit your interactions, it limits the spread. Not all of us will know when we have COVID-19, and that is the other reason why it's important for everyone to consider getting tested. We really need widespread testing, because we know that there is a substantial amount of people that have asymptomatic infection. These people, if you know that you have had a contact with someone with COVID-19, get tested. If you are concerned that you may have had a contact, get tested. If you are concerned that the symptoms that you have don't really sound an awful lot like COVID, but you have been feeling kind of lousy and a little under the weather, and maybe you've got a stuffy nose, and maybe it's a sore throat, but it's not something that you feel should prevent you from going to work or school or what you normally do, get tested and stay at home until you get that result. These strategies are essential. And if you have been contacted by the health department, follow the advice you are given. Follow the advice if you are a contact to quarantine. It is a long period of time, 2 to 14 days this virus has for an incubation period. So we can't tell you that you are free of risk until you're beyond that 14-day mark, and if you have a negative test around that time as well. It is, this is a very difficult situation, and it is a difficult virus to control, because you can pass it on when you're asymptomatic. You can pass it on before you get sick. It is a prolonged incubation period, so it is a long period of time that people need to stay home, and that's difficult for people. All of this we need to work with, and all of this we need to be mindful and vigilant of, and we need to continue to reinforce this behavior. It is now more important than ever. We saw what happened in the spring. We saw our numbers go up. We've seen what's happened across the country. We want to avoid hospital surge capacity. We want to avoid more severe illness and death. And every single person that is listening to this, and the people that you know that you can talk to about this, all have a role to play. So for all those that are listening, please talk to at least 2 people today, at least 3 people. Talk to your families. Make sure that they know how their actions can influence the health of others, and be mindful of that going forward. And hopefully we will get through this. We're still a long way off from a vaccine, so this behavior is going to be instrumental if we want to continue to end the lockdown. If we do not, and these trends continue, I am concerned about the fall. I have serious concerns about the fall. And we need to be mindful now to prevent those concerns from coming to fruition.
Thank you, Dr. Whalen. Words well said. And again, we are in this together. And I'll say it, like I've said it for the last 130 some days. And actually, we're in the 20th week of this. We're in this together. It's a marathon. It's not a sprint. We'll get through it together. To everyone out there, again, I'll say this, please, the people on Facebook and stuff, I get it, but please be proactive, not reactive. Come up with solutions to the problems. It's easy to sit there and criticize people trying to lead from the front and doing the right thing. We're not perfect. I'm not going to get everything right. I will assure you as I sit here, not every decision I make is the right decision, but I base it on the people around me, and I base it on the people I got working for me, and we try to come up with the best solution to the problem. If you have a better way of doing it, by all means, call my office, area code 518-447-7040. I'll try to talk to you myself personally. I've talked to people that have called, or email us, and we will take your considerations in, because we're all in this together. There's no time for finger pointing. There's no time for blaming certain people for this. That's why I haven't decided 20 weeks ago not to criticize the President, Congress, Senate, the Governor, the Senate, the Assembly, the Legislature, because again, we have to get through this, and we'll get through this together, working together, and having each other's back. And again, that's why I love being county executive here in Albany County, because this capital region, in my opinion, is the best part of the state in New York. Hear that, New York City? This is the best part, and we're strong, and we come together, and we'll get through this together. If you have any issues with mental health, any concerns, having problems dealing with stuff, please, by all means, call 7 days a week from 8 a.m. to 5 p.m., 518-269-6634. Our 24-hour sexual assault hotline number, area code 518-447-7716. As always, the United Way number, 211 in New York State hotline. I do want to remind people, because I was just assured my phone was blowing up via text. The NBA is playing next week in Orlando, but they're self-contained. If you notice, they shut down the hotels. They had to get there early. Again, for the same purpose. They're limiting their exposure to other people, and they quarantine them for the right time, and they're being constantly tested. So, yes, you can stop texting me. I get it. The NBA will be playing down in Orlando next week.